Let me start with something we have all experienced. Think about the last time you took a medicine. You probably didn't ask yourself where it came from, who reviewed it, or what evidences were looked at. You just assumed one thing, that it's safe. And that assumption matters more than most people realize. Hi, my name is Simran. I have spent over a decade working in regulatory affairs across global pharmaceuticals as well as Australian manufacturing companies. And today I work as a regulatory consultant. What I have seen over and over again is that regulations only get attention when something goes wrong, but when it works well, it's invisible. So before we go any further, let me set the expectations for this video. Because today is not about complex legislations, we will only talk about the basics of therapeutic goods in Australia. I want to do three simple things. First, who's responsible for regulating medicines? Second, I want to walk you through how medicines are regulated at a very high level. And third, I want to explain why regulatory affairs exist. Key idea number one, who regulates medicine? So in Australia, the organization responsible for regulating medicines is the Therapeutic Goods Administration, or the TGA. I like to think of TGA as the quiet decision maker behind the scene. Their job isn't to stop innovation, it is to make sure that the products don't reach patient until there's enough confidence that they're safe, they're high quality, and actually works. So to give you an example, without a regulator, anyone could make a medical claim. But with a regulator, someone has to prove those claims first. Idea two is how actually regulations work. So the products intended to treat, manage, diagnose, or even prevent diseases are called therapeutic goods. These include medicines, medical devices, biological products, and other categories. Now, here's where most people get confused. Not all therapeutic goods are regulated in the same way. The key idea to remember, the higher the risk to the patient, the more evidence is required. To give you an example, a new prescription medicine for a serious condition that will be taken on a longer term will go through years of scientific review, whereas a lower risk product follows a different path. Same law, same regulator, but different pathway because patient risk is different. And once the product meets the TGA's requirement, it is entered into something called Australian Register of Therapeutic Goods, ARTG. And if the product isn't on the ARTG, it generally can't be legally supplied in Australia. Think of it as a point where regulator says, based on the evidence, this product meets the Australian standard. And lastly, what's the role of regulatory professionals like me? Regulations don't stop at approval. One of the most important things to remember here is even after the medicines reaches patients, regulators continue to monitor the safety data, review the manufacturing quality, and investigates the issues as they arise. Meaning the regulation is not a checkbox, it's a life cycle. And that life cycle is what allows patients, doctors, and healthcare system to trust what's being used. This is why regulatory affairs exist. When regulations work well, patients never notice, and that's a good thing. But without it, the risk is real. Regulation is a reason that innovation can move forward responsibly. In the upcoming videos, we will go deeper into the TGA pathways, how other global regulators like FDA and EMA approach the similar decisions. And if you're curious about how medicines really make their way to the patient, this channel is for you. Thank you.